بسم الله الحمد لله والصلاة والسلام على رسول الله رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي السلام عليكم ورحمة الله وبركاته. Today I wanted to do a video on OCD, which stands for Obsessive Compulsive Disorder, because I've had a lot of contact from people who are suffering from OCD, so I thought it would be beneficial to talk about what is OCD, what are the signs and symptoms, and how do we treat it, inshallah. So it should be beneficial, bi'ithnillah. Okay, so what is OCD? Essentially, it is a disorder which features a pattern of unwanted thoughts and fears, which are called obsessions, that lead you to do repetitive behaviors, which are called compulsions. So it consists of obsessions and compulsions. What are obsessions? They are unwanted thoughts and fears or impulses. And what are the compulsions? These are the repetitive behaviors which an individual does in order to address the obsessions that they get. And these obsessions and compulsions interfere with daily activities and cause significant distress. Patients who suffer from OCD may try and ignore or stop the obsessions, but that only increases the distress and anxiety. So ultimately, people feel driven to perform compulsive acts to try and ease the stress. Despite efforts to ignore or get rid of these kind of bothersome thoughts or urges with obsessions, they keep coming back. And this leads to more of a ritualistic behavior. And this is the vicious cycle of OCD. It often centers around certain themes, for example, an excessive fear of getting contaminated by germs. So people spend hours washing their hands so that these fears about contamination will go away. And people who suffer from OCD may feel embarrassed about it and not necessarily discuss it with family members. So in terms of the symptoms, like I highlighted, obsessive compulsive disorder usually includes both obsessions and compulsions, but it's also possible to have only obsessive symptoms or only compulsion symptoms. And you may or may not realize that your obsessions and compulsions are excessive or unreasonable, but they take up a great deal of your time and interfere with your daily routine and social, school, and work functioning. Okay, so in terms of obsession symptoms, these are defined as repeated, persistent, and unwanted thoughts, urges, or images that are intrusive and cause distress or anxiety. You might try to ignore them or get rid of them by performing a compulsive behavior or ritual. And these obsessions typically intrude when you're trying to think of or do other things. There's certain characteristics or themes that we see with obsessions, such as fear of contamination or dirt, doubting and having difficulty following uncertainty. So I've seen patients who have to repeatedly make wudu because they doubt whether their wudu was valid, needing things orderly and symmetrical. So people have a thing around symmetry, switching lights off an odd number of times, repeating something an odd number of times, jumping across drains an odd number of times or an even number of times. People can experience aggressive or horrific thoughts about losing control and harming themselves or other people, and also unwanted thoughts, including aggression or sexual or religious subjects. The examples of obsession signs and symptoms include fear of being contaminated by touching objects others have touched, doubts that you've locked the door or turned off the stove, intense stress when objects aren't orderly or facing a certain way, images of driving your car into a crowd of people, thoughts about shouting obscenities or acting inappropriately in public, unpleasant sexual images, and avoidance of situations that can trigger obsessions, such as shaking hands. So what about compulsion symptoms? So as I mentioned earlier, these are defined as repetitive behaviors that you feel driven to perform. These repetitive behaviors or mental acts are meant to reduce anxiety related to your obsessions or prevent something bad from happening. However, engaging in compulsion brings no pleasure and may offer only a temporary relief from anxiety. So you may make up rules or rituals to follow that help control your anxiety when you're having obsessive thoughts. These compulsions are excessive and often are not realistically related to the problem they're intended to fix. As with obsessions, compulsions typically have themes such as washing and cleaning, checking, counting, orderliness, following a strict routine, demanding reassurance. And examples of compulsion signs and symptoms include hand washing until your skin becomes raw and red and starts bleeding, checking doors repeatedly to make sure that they're locked, and this takes up a lot of your time, checking that the oven or the stove is shut off and is off, and you do this repeatedly, counting in certain patterns, silently repeating a prayer, word or phrase, and arranging goods to face the same way. In terms of severity, everybody is different, so OCD can vary in terms of symptom severity. It usually begins in young people and teenagers or young adults, but it can start in childhood as well. Symptoms usually begin gradually and tend to vary in severity throughout life. The types of obsessions and compulsions you experience can also change over time. So you may have an issue with contamination, and then that can shift to obsessions about symmetry, and then that can shift to obsessions of a religious content. Symptoms generally worsen when you experience greater stress. So stress and anxiety increases the OCD symptoms and is considered a lifelong disorder, can have mild to moderate symptoms, will be so severe and time consuming that it becomes disabling. All right, so what about causes? The causes are not really properly understood. There are a different number of theories, and we can divide them into biology, genetics, and learning. So in terms of biology, OCD may result as a result of changes in your body's own natural chemistry or brain functions. Genetics, OCD has a genetic component, but specific genes have yet to be identified. If you have a family member with OCD, then there's a higher risk of another family member developing OCD. Learning, so obsessive fears and compulsive behaviors can be learned from watching family members or gradually learned over time. What about risk factors? Factors that may increase the risk of developing or triggering obsessive compulsive disorder include family history. So having parents or other family members with the disorder can increase your risk of developing OCD, like I mentioned. Stressful life events. If you've experienced trauma or stressful events, your risk may increase. This reaction may, for some reason, trigger the intrusive thoughts, rituals, and emotional distress characteristic of OCD. And other mental health disorders. So OCD may be related to other mental health disorders such as anxiety disorders, depression, substance abuse, or tic disorders. It can be very disabling, and the complications that result from it may include excessive time spent engaging in ritualistic behaviors, health issues such as contact dermatitis from frequent hand washing, difficulty attending work, school, or social activities, troubled relationships, overall a poor quality of life, and some people can experience suicidal thoughts and behavior. Prevention, unfortunately, there's no sure way to prevent OCD. However, getting treatment as soon as possible, so delaying the time that you have OCD, and early intervention may help prevent OCD from worsening and disrupting activities and daily routines. Okay, what about treatment? Well, like I mentioned, unfortunately, we don't have a cure for OCD, but we can use treatments to bring symptoms under control so they don't rule your daily life. Depending on the severity of OCD, some people may need long-term, ongoing, or more intensive treatment. And basically, there are two main treatments for OCD, which are psychotherapy on the one hand and medication on the other hand. And often treatment is effective as a combination of both psychotherapy and medications. So what type of psychotherapy do we use for OCD? Well, cognitive behavioral therapy is a type of psychotherapy which is very effective for many people with OCD. And I've mentioned in previous videos, essentially CBT is a way of thinking where you break down thoughts, feelings, and behaviors and how they interact. As part of treatment for OCD, we have something called exposure and response prevention, ERP. This is a component of CBT therapy, and it basically involves gradually exposing you to a feared object or obsession, such as dirt, having you learn ways to resist the urge to do your compulsive ritual. So you put a person who has an issue with contamination, maybe in an unclean environment, and then train them not to or resist the urge to hand wash. ERP takes effort and practice, but it has a good evidence base in terms of improving quality of life once you learn to manage your obsessions and compulsions. Okay, medications. So certain medications can help control the obsessions and compulsions of OCD. Most commonly, we use antidepressants or SSRIs, and these are licensed to treat OCD. Examples include Prozac or fluoxetine, clomipramine, fluvoxamine, paroxetine, and sertraline. Okay, in terms of other treatments, we have intensive outpatient residential treatment programs or comprehensive treatment programs that emphasize ERP therapy principles may be helpful for people with OCD who struggle with being able to function because of the severity of their symptoms. These programs typically last several weeks. There's another treatment called deep brain stimulation, DBS. This is approved by the Federal Drug Authority in the US to treat OCD in adults aged 18 years and older who don't respond to the traditional treatment approaches or first-line approaches. DBS involves implanting electrodes within certain areas of your brain. These electrodes then produce electrical impulses that may help regulate abnormal impulses. We also have transcranial magnetic stimulation, TMS, and this is a specific device, brainwave deep transcranial magnetic stimulation to treat OCD in adults aged 22 to 68 years when first line of traditional treatment approaches have not been effective. TMS is a non-invasive procedure which uses magnetic fields to stimulate nerve cells in the brain to improve symptoms of OCD. Okay. During a TMS session, an electromagnetic coil is placed against your scalp near your forehead, and the electromagnetic delivers a magnetic pulse that stimulates nerve cells in your brain. That's it. So in terms of treatments, inshallah, that was beneficial, and I plan to hopefully do some podcast episodes with Gabriel and Khalil talking about OCD, where you inshallah will be able to interact and ask questions. Until next time, this is your brother Dr. Abiza. Assalamu alaikum wa rahmatullahi wa barakatuh.